Testing 1, 2. There's something completely off. Oh, he's good now. Good. Whew. Okay. All right, good. Still presenting? Yes.
Leighton, please let them know that when they're texting, it's coming up on the screen, so we're seeing what they're writing.
I can hear that. Okay, good.
Thank you all. Are we ready to resume? All right, Chair Mosier, we're back at 5:48.
Okay. That brings us to item number 2. That's the financial package for the period ending July 31. Mr. Cervantes, you going to handle that?
Yes, sir. Thank you. Thank you, Mr. Chairman, Dr. Hensley, members of the board. Let's see if I can get to the right, yeah, this is not the right one. Yeah.
Okay.
So I'll try to go through this very quickly, Mr. Chairman, because I know we have a long night, so I'll move as quickly as I can. We are in the 11th month of the fiscal year. This report is through the end of July, 92%, so we only have one more month remaining. Our revenue in this year is $113 million. Our expenses are short of $98 million, leaving us a fund balance of almost $16 million. That's for this year, still with 1 month remaining. When we compare this to last year, our revenue is up $1.8 million. Our expenses, however, are up $3.7 million, which would leave us a net increase in fund balance, a decrease in fund balance of $1.9 million. Keep in mind that we refunded those auxiliary revenues somewhere around $3.3 million. Speaking of which, the auxiliary sales and service, you can see the percentage as a comparison by source is down by a couple percentages, and consequently the tuition fees actually went up a little bit, even though we are up there, but it's also just a mathematical portion of it's mathematical. And this shows the, not quite see all of the, this is the net tuition and fees. See, the budget is $71 million. Our net tuition and fees revenue is at $70 million. We are at 98.1 compared to our budget versus last year we were at 95.2. So actually closer to our budget than end of our budget than we were last year at this point in time. Not sure why it's cutting off the top part of that, Joe. I'll leave it if we're getting the audio, I guess. So our tuition revenue is at $2.1 million. The bulk of that is our out of district, as has been the case throughout. Our fee revenue is up $2 million. General fee is the largest part of that, up $2.5 million. Comparing some of the larger auxiliaries, housing and food service, we budgeted $11.2 million. We're at $8.3 million. Again, we ended up giving out $3.3 million, so we're down 2.9. If we hadn't returned some of that money, we'd be in the positive. Our auxiliary sales revenue is down $2.5 million, again, for the same reason. Go ahead, Joe. Hear me, and now you can see it. Auxiliary service revenue, as I said, is down 2.5, and that's the bulk of that is our refunds. I don't think this is going to be a good day, Joe. It's not moving down now. I can tell you what it's going to say.
He's coming.
It's not going down, just hitting page down. So our total expenses compared to 2019 are $3.7 million increase compared to last year. Our fiscal, and the bulk of it is in our salaries and benefits. You see the $4.2 million increase, and that's because we had a 5% increase in personnel cost. Our fiscal year 2020 expense by category, $3.7 million. Salary and wages remained the largest portion of that at 71%. I spent a little bit of time just telling you about, I've been waiting and I've been asking the staff, at what point in time will some of these costs begin to go down compared to last year, because there isn't as many people here. We haven't had staff here, we haven't had students here, or certainly not as many of them. Well, the E&G is now coming through towards some of that, and what we're seeing is travel is down significantly, utilities are down, not by a whole much, 150,000, and then consumables are down. All of those adding up pretty close to about $1 million over the course of the year. So by the end of August, we should be down even further. Operating expense compared by function, $2.9 million increase. The bulk of that, of course, is, as I said, is salaries and wages. 2016, the money that just keeps on giving, Mr. Chairman, had $11 million at the beginning of this fiscal year. We're down to $1 million. You'll hear a request at the end of this. There's an action item to repurpose some of this fund so that we can spend the remaining money by the end of February of next year. Student cash and refunds, we received almost $7.5 million in July. Financial aid drawdown from the Department of Education, $800,000. You can see the offsetting CARES accounts, $122,000. The money came in and money went out. The bulk of this is the student payments that were made, $7.7 million, but we issued almost $1 million worth of student refunds also. Other cash receipts is also for July is also in the $7 million, $7.7 million. Still receiving a modest amount, $41,000 for the month of July in interest. Our state appropriation is $2.3. The bulk of this is the drawdown from cash. So we spend our money to pay for these capital projects that we have, and then we reimburse ourselves from the bond money that we have set aside. So that 5.3, that's where that's coming from. $18,000 in grants and contracts. We used in July a large amount, $11 million. Our average is somewhere around 8.5, so this one is higher. Payroll, of course, still remains 3, and then almost $4 million in accounts payable, and R&R is almost $1.8 million. So in summary, we received $7.5 million from students. Our other sources at 7.7, but we used almost $11 million. For the month of July, gave us a 4.2 increase to cash. We kept $2.2 million in the bank and put the other $2 million and invested in the investment pools. Want to show you where we're at the end of July. Unrestricted cash and cash equivalents, almost $99 million. This is despite, as I have said before, turning back or giving out additional money for refunds for auxiliaries. Still maintaining the reserves in both the capital projects as well as the operational costs. The STE building, note that we had dedicated $3 million. In a later report that I'll give you, you're going to see that number is going to come down closer to $2.2 million because we're going to use some of the 2016 money. That concludes my financial report for July. I stand for any questions.
Any questions? Hearing none, Mr. Cervantes, I believe that's it. Thank you, sir. That brings us to item C. It'd be institutional enrollment report for the summer number 2 session. Vice Chancellor Buck.
Good evening, Chairman Mosier and Dr. Hensley and Board of Trustee members. This slide shows our 2020 Summer 2 enrollment numbers, which began on July 6th and ended on August 3rd. As you can see for this term, we exceeded our 2019 numbers in terms of headcount by 5.02%, credit hours in 5.33%, and in contact hours by 6.46%. As a reminder, this was another term that was completely online, as after spring break of this year, all course offerings were moved to the online modality. This term represents the end of the 2019-2020 academic year for enrollment purposes, and just like fall 2019, winter mini-mester, spring 2020, May mini, and summer 1, this term surpassed our corresponding previous academic year numbers. Thank you.
Any questions? Thank you, Ms. Buck. All right. That brings us to item D, the update on the COVID-19 and college operations. Mr. Schubert, you going to lead that discussion or presentation?
Yes, sir. Thank you, Chair Mosier, Dr. Hensley, Board of Trustees. We have another update for our COVID activities. This one's focused on the fall preparations, and of course, classes started on a Monday. Wanted to give you guys a timely update on those items. You're going to hear from several staff members. We're going to start off with Dr. Marcelo Bosicki. We'll talk about the academic affairs items. Vice Chancellor Jay Anderson will talk about the workforce and the Health Science Center aspects. Then we'll have Dr. Diane Lovell. We'll talk about our student services piece. We'll have Richard Cervantes come and give you an update on the financial side and also food service and those sorts of items. Then Scott Schumacher will be joining us online. He'll be talking about the athletic changes for the fall. Marie Kirby will be joining us online as well to talk about the HR side of things. Rich Bray will follow up with the marketing aspect of these items, and then we have our Baylor Scott and White partners who will be doing the cleanup on this presentation and then questions after that. So I'll call up Dr. Bosicki to start the process.
Thank you, Leighton. Okay, Dr. Hensley, Chair Mosier, members of the board, I will share with you the academic portion of our Back with Blinn plan. In March of this year, due to the COVID-19 pandemic, the college was faced with a challenge of offering over 2,000 classes in an online format. Thanks to the dedication of Blinn College faculty and staff, within 2 weeks, in the middle of the semester, all 2,000 sections were available online for students to continue their studies. As we prepare to address this upcoming fall semester, for safety reasons, we decided that all summer classes would remain online. From the spring semester experience, we learned a few lessons that helped us craft our plans for the fall. We learned that faculty and students needed training. We learned that students needed virtual academic support and that students needed flexibility when choosing modalities of learning and schedule. These are some of the virtual resources that were implemented during the spring, carried into the summer, and continue in the fall. We were very successful implementing them, and we decided that those still should remain. Faculty training, online training, we purchased a tutoring platform, online tutoring platform that will help tremendously the student actually already from the spring, summer, and upcoming fall. The online writing center, and we invested heavily in expanding our virtual abilities to serve our libraries. These are some of the trainings that were offered during this summer. Many of these were already part of the spring. offered during the summer. And Chair Mosier, if I may, just a parenthesis, some of these workshops were also offered today during our convocation. It was phenomenal. If I may, sir, I would like to thank the faculty who prepared, our faculty that trained and presented to our own faculty. It was an amazing experience, extremely professional. Thank you, everybody that organized that. This is an example of how easy it is for a student to find tutoring at Blinn College. This is a landing page with our eCampus, which is our learning management system. As you can see, there is a prominent icon there, online tutoring. When students click on that icon, they are taken to an online tutoring platform that connects them to an available tutor or give them the opportunity to schedule an appointment. As for curiosity, when we implemented, I went myself to get some tutoring there, make sure that works well. It works perfectly. Fall 2020. All fall classes will have an eCampus page with content loaded in case we need to move classes online on a short notice. What we designed, it was one approach with 3 strategies. The first was to offer shorter semester terms, and we concentrated on 8 weeks and first 8 week and second 8 weeks, which splits the semester essentially in the middle. If there is an increase in cases and we have to move to an online environment at that time, hopefully part of the semester will already be done and students will already be accomplished part of their studies this fall. We also decided that was, as I said, it was important to offer flexibility in types of modalities, but all of them had to have a component, a remote component to it, because we didn't know what to expect. Therefore, the work that was done by Academic Technology was phenomenal. They installed 250 cameras all over the district to broadcast all our classes. And if should a student get sick and not be able to attend class, that student can access that class remotely. It's working very well. Faculty is actually already training on that. For the sake of time, I'm not going to go over each one of these modalities, but it suffices to say that all of these modalities that we're offering this semester have a remote component to that, and that 95% of classes that we are currently offering have the ability to remotely access at any time. We have 4.5%, 222 classes that are traditional in the sense that we understand traditional classes, and those are classes that are not conducive. Workforce classes and a few ag classes are not conducive to a remote component to it. I would like to draw your attention to some special programs in academic affairs. So those are populations that are particularly related to the Brenham campus. Groups such as band, choir, theater, and in ag have special academic requirements that need to be worked so that we can keep students safe, but still achieve the learning outcomes for those courses. So this is the overview of the academic portion of our return to campus. I want to thank for the opportunity and let you all know that it's very good to see you in person. Thank you very much. I would like to invite my colleague, Vice Chancellor Jay Anderson, to join us.
Thank you, Dr. Basicki. Good evening, Chair Mosier, Dr. Hensley, members of the board. Next. I was invited in to discuss THECB, the Higher Ed Coordinating Body minimum standards and guidelines. Blinn College was to deliver as much content as possible via remote, online, or distance education, particularly for at-risk populations. We have completed this and continue to do so. Train all faculty, staff, and students on appropriate cleaning, disinfection, hand hygiene, and respiratory etiquette. Again, this is complete and continues as in process. Screening all individuals before coming into the classroom or laboratory, including anyone diagnosed with or being investigated for COVID-19 by a licensed healthcare provider. This will continue. Have all individuals wash or sanitize their hands upon entering the classroom or laboratory. Again, this has been taking place and will continue. Consistent with the protocol for career and technical education programs, including health sciences, we have a policy in place and follow that policy for the institution and how it will respond if a faculty member, staff member, student, or campus visitor begins to show symptoms while in class or on the campus. Thoroughly disinfect after each use or class period any items that come into contact with faculty, staff, or students. We will have all individuals maintain at least a 6-foot separation from other individuals within our career and technical education programs. If such distancing is not feasible, other measures such as face covering, hand hygiene, cough etiquette, cleanliness, and sanitation will be rigorously practiced. Next. In July, it went backwards. I will continue on. In July, President Trump announced that there will be vaccine manufactured through Fujifilm, Texas A&M, Fujifilm. We are in conjunction with Fujifilm within our biotechnology program. Next, as representation of that relationship, Blinn Corporate College has trained 191 Fujifilm employees for a total of roughly 5,000 hours. The pharma courses include cell culture, bioreactors, upstream processes and value-added processes within the pharma area, introduction to aseptic and analytical techniques equaling 512 hours, and protein chemistry and chromatography at 520 hours. Next, please. Our engagement with Fujifilm and Blinn Academic Biotechnology. Fujifilm has engaged Blinn College to create an apprenticeship program that feeds into the company's local growth in terms of outreach effort. Fujifilm Human Resources continues to reach out to Blinn College to seek candidates to fill open positions within the corporation. And Fujifilm has hired Blinn Biotechnology laboratory science graduates for positions within their laboratories. We value their partnership, and it remains a very strong, growing partnership. With that, I will turn it over to my colleague, Vice Chancellor, Dr. Lovell.
Good evening. I'm Dr. Diane Lovell, and I'm here to tell you tonight about the protocol we're following for student services to make our students safe, and some housing protocols specifically. And in conjunction with the comments that the Chancellor made earlier tonight, I'll give you a few additional details about our new self-certifying app. At Blinn, we're trying to create a low-risk environment so that our students won't spread the virus. So tonight I want to tell you a little bit about housing. We have moved in over almost 400 students now. We're doing that move in a phased step, 6 days instead of a one big day, and it's proving to be very successful. I want to tell you about some of our day-to-day living, and we've been working in a partnership with Baylor Scott & White. We've looked at the guidance for the CDC and, of course, the Texas Higher Education Coordinating Board. And we've been studying for months how to make it a low-risk environment with lots of protocols and lots of training. And we want to reduce the risk of the spread. And this even goes over into our student life and our student recreation and how to make it a safe environment. Our housing check-in has been very successful. We might think about doing this again because it's going so well instead of one big mad rush to go in. Every student and their one visitor that can come with them, usually one of their parents, goes through a health screening before they're allowed in the dorms. We have a culture that we are establishing even from the first hours of the move-in to the housing, a culture that we have expectations that our students wear masks, that they social distance, that they hand wash frequently, that they are aware of their own health, and that they report that health if they have any symptoms or are testing positive. We want to really have a culture where we set an example, all of our staff set an example to emphasize that the virus is an invisible enemy. So Buccaneers need to wear a mask to fight that enemy and as a mark of respect for other people's lives. We know that that has to be established in the first days, the first hours that they are on campus and in their classes, and so our staff has high expectations of that. Now, if a student were to fall ill, they would have an option to go home, a student that lives in our housing. They would have an option to go home. But if they choose not to go home, we have set aside 30 rooms, and we have them set aside for quarantine and isolation. We have 2 full-time hall directors whose only duties are to look after the people in those rooms. They'll bring them food. They'll have frequent video communication with them every day and attend to their needs and anything unexpected that happens. Now for recreation, we have closed our game rooms where you can play pool, etc., because that's not real conducive to social distancing. But we are opening the Cruzy Center with strict hygiene and cleaning protocols in place. The basketball goals are raised, unfortunately, but students can come to the Cruzy Center and they can work out there if they are social distancing and only by appointment. We have many activities in student life, but almost all of them are now virtual. To elaborate on that, we've had to shift to a new paradigm altogether. Can you imagine having to shift from student activities usually meant in person, and now virtually all student activities are virtual? And I'd like to thank Dean McBride for her and her team's tireless work. They have erased all their previous expectations of what student activities are and have created an entirely new, exciting model for recreation. Here are just some of the student activities that are available just in this first week. And they include things like a virtual dance class and game shows where students can participate by text. We are partnering with Ivy to create an easy one-step self-certification process for students and employees. We launched that last Saturday. So all students will complete the daily required self-certification and simply visiting Campus Clear and downloading the app. It only takes 10 seconds a day. You answer one question, it's a multiple choice question, and hopefully you'll just click on no symptoms. But if you do have symptoms, you click on another button, and depending on which of these 4 buttons you click on, we will say to you on the app, you're good to go, come to campus, or we're sorry, you're not cleared to come to campus, and click here to get some more information about what you should do next. I thank you for your time.
So what I'm going to be discussing today in this short presentation, what the school is going to look like for students and faculty and staff that are returning, what the facilities are going to look like, what's been done in terms of disinfecting and sanitizing, and then I'll talk about food service and end on a financial note. So this is what the classroom is going to look like. We essentially are trying to have 6 feet between each of the chairs. What we've noticed in the classroom is that the classes or the seat occupancy is going anywhere from 50% to a third, to 33%. Also going to have done the same thing with food service. I'll talk a little bit more about that. We've taken over the banquet room and added some seats there, again for social distancing. These are all the signs, or some of the signs that a student and employees will see as they come back to campus, encouraging the social distancing. We've ordered some personal protective supplies. This is a picture of the hand sanitizer stations. I happened to look at an article today for AT&T, and they're opening up with 300 of these hand sanitizers across their stadium. That's less than what we ordered for the district. Plexiglass, you can't see it real well, that's why they put the arrow there. In the food service area, particularly in the banquet room, these plexiglass have been put in either sideways or horizontal or vertical, so a person that's 3 feet or right across from you will have a shield so that they won't be able to infect each other theoretically. Oh, I did want to say too, electrostatic sprayers, which is the second item there. We have sanitized the entire district, and so we've hit everything at least once for now. So when the students return, everything's been taken care of from that perspective. Food service plan, part of what we've tried to do, I said that we took over the banquet room. We went from 660 seats in that 2-area dining room that we had down to 205, so that's why we took over the banquet room and added another 100 seats. Still about 50% occupancy. The to-go options, this is a truck that we've leased out. We've not bought it. It is hopefully to be able to give as many to-go options out there as we possibly can for students. We're trying to encourage them not to go into the dining room, but if they and this is an opportunity for them to do that. I mentioned I'd end with a financial note. We have the institutional portion of $7.7 million. I'm sorry, $7,700,000. This is for the delivery of instruction. This is money that we received from CARES. We also received some money from institutional strengthening, but not near as much. This is also CARES, $701,000. The difference between the two, the first one, see what I've underlined, significant changes to the delivery of instruction. So you have to tie to whatever expense that you have to the delivery of instruction. On the other hand, the institutional strengthening, although it's very small, comparatively so, has a provision in there for including lost revenue, which is not in any of the other ones that we have. We have a institutional portion that we have either encumbered or expended through the end of July, $5.7 million. We have a year to use that up and get reimbursed for it. So it started, I think we signed that in July 1st, so we have plenty of time. Institutional strengthening, you see most of that is the PPE that we have purchased. And now I'm going to introduce Mr. Scott Schumacher, I think, who's going to be joining us remotely.
Thank you, Mr. Cervantes. Hopefully you guys can hear me. I'd like to also thank Dr. Hensley, Chairman Mosley, and the board for allowing me to visit with you tonight regarding athletics. Before we start, I'd really like to thank Dr. Hensley for working with our athletic department to help ensure that our athletic staff and our student athletes are staying healthy in their safety, and that has been a big concern, and Dr. Hensley's put in a tremendous amount of hours helping us with that, so thank you, Dr. Hensley. In July, the national office met an emergency meeting. They decided that the majority of the sports that are offered by the NJCAA will be moved to the spring. Some sports will still stay in the fall, but those are sports that Blinn College does not participate in. Example, women's tennis, cross country, those will still take place in the fall, but everything else has been moved to the spring. Next slide, please. Basically, just to give you a background, when an example in the fall, and we'll just use men's basketball as an example. In the fall, the first official starting date is October 1. So up until October 1 in the month of September, you're allowed to practice 8 hours a week with your student athletes. And then once October 1 comes, then you can practice as long as you want for as many days as you want. So basically what the NJCAA is allowing us to do this fall is they're going to allow you 60 consecutive calendar dates for fall practices and scrimmages including in that. An example for Blinn College, those dates will vary. Like I'm sure baseball and softball would start different dates than, example football. So those are days that we will discuss later on. In mid-September, Blinn College, we're going to revisit the possibility of starting those practice dates and the safety of our student athletes, the coaches, and the campus community as a whole. We kind of just want to, take our time and make sure that everything is safe before we move forward. Next slide, please. So this would be an example is when the student athletes check in from the first day of class until the middle of September. We would not have any athletic activities, making sure that people are safe, that there's not an outbreak within our athletic department with COVID. And then sometime between the 15th and the 20th, we could start having individual group works and weights, and then starting a 60-day practice schedule starting October 5th and ending the 22nd. An example with the small group work and weights, I'll use baseball as an example. I've talked to Harvey. He would take his 38, 39 guys and break them into groups of 4. So they'd have 10 guys on the field. They'd have 10 guys in the batting cage. Then they would switch. Then those 20 guys would be done for the day. Then he'd bring in a new group, new 2 groups of 10 so they could practice like that and get some small group work in. The NJCAA is allowing in the fall to try to keep your student athletes engaged. They are allowing outside competition for scrimmages. So an example, men's basketball could play 5 scrimmages or 5 scrimmage dates. Baseball and softball, I believe they could have like 10 scrimmage dates down from the 20, but Blinn College has decided to not do that in the fall. All our coaches are fine with that. We can have inter-squad scrimmages. I'm looking right now into possibility of an example like on Monday night we would have an inter-squad women's basketball game, on Tuesday an inter-squad men's basketball, on Wednesday an inter-squad volleyball, just to keep our students engaged, but all our student athletes engaged, but also the students on campus. Obviously, we'd have to, watch the numbers and things like that and social distance, but be able to allow them to be able to watch a competition with baseball, softball, all of our athletic teams. So we're looking at that very much. So we have a lot of protocols in place for pre and post practices. Obviously, they'll have all the signage, things like that. An example, what is going to happen, like I'll use football an example. Football has broken their locker room into 3 different, for lack of a better word, 3 different colored dots. So the white dots would all show up at a certain time to dress. As they come in, they will all get their temperature taken. They will all be recorded. Then they will wash their hands, sanitize their hands. They will go in, get dressed, and then they will leave the locker room. Then everybody with the blue dot will come in and go through the same thing and record all the temperatures and all that. When everything is done for the day, we have purchased disinfectant that you can spray. We already had that before COVID-19, and we would basically use it once a week. That's why our staph infections are really down with athletics. And this other disinfectant, what will happen is we're done softball practice. All the girls, take their time getting dressed as far as in groups. Then when that's done, we will disinfect the locker room each day and disinfect all of the equipment, bats, softballs, everything that is being used. Obviously, water bottles, everybody has to produce their own water bottle for practice, things like that. So, everybody has, you can turn to the next one, please. Yes, thank you. We've all been working on this together for a very long time. An example, the football team, and I know like they're looking at practicing as 2 different teams. So they'll have 51 or 52 guys come in for practice. Those guys will leave, then they'll have 51 or 52 more guys for practice. It'll be a little bit longer for the coaches, a little bit shorter for each student athlete, but we think that reducing numbers will really, really help. And then obviously each individual sport will have certain things that they will have to use. But I think that once we get going and once we see how safe the environment is for our student athletes, I think our coaches understand the seriousness of this. I think our student athletes want to be out there, so they will follow the protocols and what we're asking them to do. And we're looking forward to the fall semester. And I appreciate you guys having me. And with that, I'll turn it over to Marie.
Good evening, Dr. Hensley, Mr. Mosier, and trustees. Thank you for the opportunity this evening to give you a little bit of an update on what we're doing with our employees. As Dr. Lovell kind of alluded to earlier, we are all, as a whole campus, student, faculty, staff, will be utilizing the Ivy app in order to self-certify. So all Blinn College employees, students, and visitors will be required to complete a daily self-certification using the free Campus Clear app before entering any Blinn facility. If someone does not have a smartphone or are unable to download the app for any reason, they can also go to the web app or go to the website and can do it on any computer as well. So self-certification, the reason that we're asking everyone to cooperate with us and to self-certify before coming on campus is really truthfully to protect the health and safety of our campus community. All of our employees, our students, our guests, anybody coming on campus, even vendors, if someone is coming on campus as a third-party vendor, that person too will be required to self-certify before entering any Blinn College facility. Blinn has partnered with Ivy to create an easy one-step self-certification process for students and employees. To complete the required daily self-certifications, employees and students can, as I said, visit the Campus Clear website and complete their certification on the web, download the app at the App Store for iOS users, which basically can be your smartphone, or download the app at Google Play, and that's for Android users. So there really is an option for almost everyone. If someone still has difficulty with that, we have optional alternatives for those folks who can contact HR. You're going to register basically your email address. It's very, very simple, and you get the update every single morning. And it really truthfully does take about less than 10 seconds to just kind of log on, answer some basic questions, and we'll show you what that is. This is basically, I'd like to give a shout out to Rich Bray and Darla, his team, for developing these flyers and the posters that we're putting around campus. If you go through the little steps there, it makes it very, very easy for anyone to use this. So thank you to marketing for assisting us with that. All right, so this is what you'd see if you open the app. It will ask you some basic questions. And the questions we were able to create within this app were basically the questions that we've utilized with employees all summer. And it worked very, very well for us. We didn't have the app. We used another form for collecting that data, but we felt that it worked pretty easy. It was simple. It doesn't take long. It's to the point. And so we'll be utilizing those same questions with both employees and with our students. And basically, depending on how you answer the questions, if everything's good and you're good to go, it gives you the little smiley emoji. It tells you you're good to go and to come on campus. If you answered the questions and in such a way that you are telling us that perhaps you've been exposed, you've tested positive, you've developed some symptoms, you're feeling this way, then basically you get a different emoji, and it tells you you're really not cleared to come on campus at that particular point in time. And then there's some protocols that on the app, or it will take you to our website. And in that website, it basically will show you or walk you through the steps. It has information about our health clinics. It tells you that if you're an employee, someone from HR will contact you. If you're a student, another person will contact you and walk you through that. It allows us to kind of do some internal contact tracing by trying to find out, okay, in which building were you? On what date were you there? What was the last time you were in the building? Can you kind of give us some idea of how many people you were around? Were you within 6 feet for, what length of time? Were you wearing a mask? Let's hope you were wearing a mask because that's mandatory. But those questions help guide us then as to what those next steps are. And if we do need to perhaps then close an office area, close a classroom, actually close a building, then we would work with our police chief, contacting him. He would go in, have some of his staff members, officers close it off and deny access to that area. At that point, then we work with Mr. O'Malley and his team, Mr. Cervantes, and they will come in then and sanitize that area, be it an office area, a classroom, a building. And once that has been completed, then we can open that up again for access to both our students and our staff and our faculty. We also are going to be providing COVID-19 training, which will be part of our mandatory training through HR for all of our employees. The platform that we're using at this point is provided through Safe Colleges. It's a third-party vendor that Dr. Hensley was kind enough to allow us to purchase. And it offers us many different types of training. And one of those platforms of training is on health. So our employees would have the option to go in even beyond the mandatory training if they're wondering about masks, if they're wondering about sanitizing. Many different topics are in there, as well as LinkedIn Learning that we have as well. But we will be providing coronavirus awareness training for all, just so that everybody can be on the same page. Although we think that everybody's on the same page, because I think that's all anybody has heard for the last, since March or even beyond that. It's important that as an institution, we are all moving forward in the same step. And I think this mandatory training will help us to do that. All right, and then finally, how do we get our employees safely back to work? Is there one size that fits all? Probably not. Basically, what we're doing is if someone truly has a health condition, if someone is vulnerable, if someone is having issues with school, daycare, that sort of thing, what we ask, and we've provided this with our Back with Blinn, an employee can go in at that particular point in time, and they can fill out this form. They send it to us in HR. And depending on what they've checked or what they're asking for, then what we do is we follow up. We are needing documentation, perhaps it's medical documentation, it could be something else. And then we do an evaluation as to what can we do. Could it be less time on campus? What drives that is the job responsibilities in your job description, because everyone, if you're working as a plumber, you can't do that really very well from home. So we're basically looking at your job description. And then we also look at, the parameters of our policies, of the federal laws and the guidelines that more or less are our umbrella. And at the end of the day, we want to make sure that we're treating everyone fairly. We're also trying to get everyone back to work as best that we can in a safe environment. So one of the main premises that we're doing is we're utilizing what we call staggered and alternating shifts. And so we may not be able to have an entire department come in just basically because of the logistics and the physicalities. However, what we can do is say, all right, we'll have you come in on Monday, Wednesday, Friday this week, and then Tuesday, Thursday next week. Your colleagues might come in on Tuesday, Thursday this week, and then Monday, Wednesday, Friday next week. We want to be fair and equitable. However, you still have to be able to perform all of your duties with or without an accommodation, with or without a staggered or alternating shift, and you're still going to be required to work that 40-hour week. And that's basically it. Thank you. And now I'll turn it over to Rich Bray.
What an introduction.
We all herald you.
Thank you, Chancellor Hensley, Chair Mosher, members of the Board of Trustees. As you've seen, the Back with Blinn plan covers every aspect of Blinn's operations while addressing the needs of faculty, staff, students, and visitors across the college district's full array of campuses and educational programs. For my team, our primary goals lay in two areas: providing clear descriptions and answers for the students, employees, and community members coming to Blinn campuses this fall, while also providing this information in manageable formats that are responsive to our audience's specific needs. We started by developing the Back with Blinn campaign and logo, which blends the bell tower of our institutional mark with the rising sun of a new day, representing the dawning of new opportunities this semester. We wanted to express our excitement and enthusiasm for the upcoming term as we identify innovative new strategies to meet the needs of our students. To ensure that all visitors to our website can easily find this information, we created a drop-down message that appears on all Blinn landing pages, including the homepage at blinn.edu. There, visitors can find the latest updates from Chancellor Hensley and access our Back with Blinn landing page. Once users visit the Back with Blinn page, they are greeted with a broad description of the Back with Blinn plan and a graphic that informs them of the requirement to self-certify before coming to campus. Users can then click on that image to go directly to our self-certify page with links to download the app and answers to our most common questions regarding self-certification. The Back with Blinn page also includes a list of our most recent updates, so users can easily find the items that have been updated or added. We've divided this content into 9 categories: campus safety and health, tips for stopping the spread, self-certification and COVID-19 testing, academics, classroom procedures, campus housing, campus services and activities, employee information, and other information. Each of these categories has a dedicated page with an FAQ providing the latest information. At the Back with Blinn homepage, students can view a video that describes our 4 course modalities. Filmed with the assistance of academic affairs, student services, and academic technology, this video shows faculty and students how the live online portion of the class works and illustrates the way that the classroom technology installed this summer allows faculty and students to connect in a virtual environment. In addition to the Back with Blinn webpage and our associated digital, newspaper, and radio advertisements directing students to this information, Blinn has been very active on social media. To answer the most common questions regarding Blinn's return to campus, our graphics design team created 50 graphics covering each category in the Back with Blinn plan. These informational graphics are a regular feature on our social media and are also posted on campus TV screens across the district. We also use these graphics to create a slideshow video that provides an engaging visual outline of the Back with Blinn plan, and also created shorter slideshows specifically focused on academics, campus health and safety, and housing and student services. Of course, to truly connect with our students and their families, and to conveniently address their needs, it is important to create two-way communication opportunities. That's why we introduce live question and answer sessions on Facebook and Instagram. For the past 7 weeks, we've hosted regularly scheduled live events with a member of the Blinn staff, answering questions related to COVID-19, admissions, registration, academic advising, housing, athletics, and student activities. These events have enjoyed immense success, including a Facebook Live session that drew more than 1,300 total viewers. Based on this success, we expanded these sessions to take place 4 times each week, with noon Instagram Live sessions on Mondays and Wednesdays, and 6 p.m. Facebook Live sessions on Tuesdays and Thursdays. Since we have not been able to offer campus tours since the pandemic hit, We also introduced brief facility tours for these Q&A sessions. In recent weeks, students have been able to view a variety of locations across our campuses. These events have been a collaborative effort, including the leadership of Vice Chancellors Karen Buck and Diane Wuffel, and everyone who has worked to make these events possible, from our Q&A hosts and our tour guides to the executive deans and others who have opened their facilities for these events. They represent just one small way in which Blinn's entire district has come together to provide a safe environment for our employees and to proactively share our plans for the fall semester with our students and the community. On behalf of the leadership team that preceded me in this evening's presentation, I particularly would like to thank Dr. Hensley for her guidance throughout the planning process for this fall semester. As Dr. Busicki may attest, Dr. Hensley has been like a maestro guiding an orchestra through a challenging piece of music, and she has led us through this process with her typical dedication, grace, and attention to detail. Thank you, Dr. Hensley, for your leadership and support. At this time, it's my pleasure to introduce Regional President Jason Jennings and Dr. Eric Alford from Baylor Scott and White. Got it?
Yeah.
Good evening, and thank y'all for having me. Jason wasn't able to make it tonight, so y'all get me in. Unfortunately, I didn't have the welcome that he had with the phone. I wish I could have had that. That was perfect timing. Tonight, I just want to kind of reiterate what we've already talked about before and what the leadership here has already done, and applaud you guys for doing what you have done to make this campus safe for the return for students. I gave this presentation a few days ago to the resident hall directors and the resident advisors, as well as some other leaders at Blinn, and I think it went over well. And the thing that I got out of it more than anything was that the students who were there, the student leaders, were actually really enthralled and asked some really, really good questions, some of them that were even challenging to me, which tells me that not only are the leaders here tonight in this process, but the student leaders are involved as well. I mean, they're committed to what they're doing. I'm going to go through this fairly quickly because I don't want to waste all this time, but the key here is that COVID, as you guys know, is here to stay, and we're learning to live with it. It's a virus, and there's no cure for it, and we're here as a health system just to help to educate the students on campus, to make sure that they are safe and that they're treated to the best of our ability. These numbers, I apologize, Vice Chancellor Buck asked me to update them, and quite honestly, I ran out of time, but these are numbers from last week, and confirmed cases here in Washington County have now surpassed 500 now, and the deaths continue to rise. Some statistics I wanted to share with y'all, and these are based on the Baylor Scott and White College Station region. But one thing I pointed out to the students the other day, and I want y'all to understand too, is that as you know, this disease is not a selective process. So you can see here that it doesn't create a bias towards any specific ethnic group, and the average age of the infected patients have actually come down. So it's affecting more of the younger population that we'll see here on the Blinn campus, especially in Brenham. Interestingly, and I made this comment to the group before, is that body mass index seems to play a really big role in this. And the point of this is that if you have a student on campus that has a BMI that is larger than 30, which places them in an obese category, those are ones that we need to pay attention to, as well as those that have known comorbidities or other disease processes that put them more at risk for complications associated with COVID. As we talked about, we're learning to coexist with COVID, and you guys have done an outstanding job emphasizing the importance of simple hygiene practices such as hand hygiene, so washing your hands on a frequent basis. I walked the campus the other day, and there's a ton of sanitizing stations all over. Social distancing is obviously being preached everywhere, which is important. And then I think most importantly, the wearing of masks is being mandated among any places that have people around, and I think that's a great step. One of the things that I think is very, very important for the Blinn campus is making sure that all faculty and staff and leaders of any form are setting the precedent for not only wearing the mask, but wearing the mask properly and being able to understand the process so that they can help other people. Isolation and quarantine, I think you guys know, but just reiterating isolation, the difference. Isolation is when a patient has known COVID, they get placed into isolation. And if there is somebody who's exposed to COVID, they are placed in quarantine to help to spread the transmission rate. And that's been done really, really well through our the campus dorms here in the apartment facilities. I'm speaking briefly on our clinic, and I mentioned this at the last board meeting. Kristen Krennick has now returned to the campus here, and she started working here on Monday. Kristen's available for video visits and face-to-face visits, and she's actually run our entire regional respiratory clinic over the past several months, and she's done an outstanding job of treating these patients of all ages. I mentioned last time too the safe care protocol that we're going to be using in the clinics. So as students come into the clinic, we have opted to maintain a walk-in policy for the clinic because we want to be as accessible as possible to the students here on campus. However, they're going to be screened immediately upon entry into the building, and we'll have also done the screening process through Blinn's program. Temperatures will be taken before they enter the building, and that way we can make sure that we are cohorting those who have COVID-like symptoms and immediately placing them in private rooms, and those who do not have any COVID symptoms or COVID concerns will have the option of sitting in our waiting area. Including Kristen and our nurse at the clinic, we'll have no more than 5 people in the building at any time, and there will be no visitors or friends allowed. When we reach that 5-person maximum, we're going to close the door and lock it, and there will be a sign up that says that no one is allowed until we have room to accommodate. I think y'all know this, but COVID-19 testing is going to be available in our clinic, and that is currently via the nasopharyngeal route, and I'll talk about that a little bit more in detail in a minute. But the COVID-19 testing that we're offering, to make it clear, is for students who are exhibiting symptoms of COVID. So we're trying to identify people as quick as possible so that we can do as much tracing as possible to stop it in its tracks. COVID-19 testing is not going to be available for people who just come in wanting testing. There's going to be specific protocols, and I'm going to go through those with y'all so y'all understand it. And ideally, this is not used for faculty and staff here at Blinn because we don't have the capacity to do so. And if we run out of our testing for students, we're going to have to seek care elsewhere. So we're asking that faculty and staff actually go to their primary care physicians, and I'll talk about that in a minute. We do have virtual care options through Baylor Scott & White. I'm not going to go through a lot of that. The nasopharyngeal swab that we're doing for COVID-19 is the most accurate testing available today. It is not a rapid test. We do have rapid tests available here in Brenham, but we do not use it outside of the hospital setting, and that's because the accuracy of the test is diminished by about 10 to 20%. This testing is actually approved through the CDC, so the tracking of it is better through the CDC, and we have guaranteed results with it. It currently takes about 48 to 72 hours to get the test results back, so the important piece of this is that when we test a student, they are going to be required to quarantine for the entire duration of that time. If they have a positive result, then we go into self-isolation at that point, and as y'all know, they're given the opportunity to go home, but they have to remain in self-isolation until they're fever-free for 24 hours. Their symptoms are improving, and it's been at least 10 days that have passed since the onset of their symptoms, and that is specifically the CDC symptom-based return to life policy is what we're calling it. If there's a negative result for these patients and we still strongly believe that they have COVID, they may be asked to remain in self-quarantine, and we'll consider retesting them 24 to 48 hours later, and that will be done at the judgment and discretion of the provider on campus. This is just another way of looking at that, and another way of saying that we shared with everybody. Contact tracing, I know you all know this. Contact tracing is, in my opinion, going to be nearly impossible for Blinn College alone to do it. So obviously we're going to be depending on Baylor Scott & White providers here reporting it to the CDC, getting as expedited of a turnaround as possible through the CDC. And then I don't know if y'all looked into it, but potentially using the Brazos Valley Coalition with Texas A&M to consider tracing there. The key here is as soon as we can identify the contact and we can trace their contacts, put them into self-quarantine, then we can actually diminish the spread throughout the campus, and we'll help in whatever way possible here. So these are the slides I want to focus on, and I won't take much more of y'all's time, but students with COVID exposure, and exposure being, as you probably know, the CDC clearly defines it as within 6 feet and 15 minutes of a person who is COVID PCR positive, so they've been proven to have COVID. If a patient presents in this situation and they're symptomatic, we will immediately test that patient or test that student and place them in quarantine. If the patient presents with exposure but is asymptomatic, there is actually no test needed, but we recommend that they quarantine for 14 days. I'm going to highlight this because previously we would continue to test these people, and as you guys know, the CDC has changed that recommendation. So we are now recommending not testing these asymptomatic patients, but waiting the entire 14-day duration, because that's the incubation period of the virus. And if they make it 14 days post-exposure, they're probably not going to become sick. Now, if a patient comes into the clinic and they have had no known exposure with symptoms, they're going to be tested immediately. I'm sorry, they have no known exposure, but they have symptoms. They will immediately be tested at the onset of their symptoms. And as I said before, just because it's negative does not mean that they don't have COVID. We'll certainly consider retesting 48 to 72 hours later, and they will remain in quarantine until we feel that they're safe to go back to the clinic. Return to life, as I mentioned before, is going to be based on the symptom-based strategy, which is what everybody, including Blinn, the public schools, and local employers are using, and I've already mentioned those. I will say at the bottom of this slide, I don't know if this has been discussed, but for patients who have never developed symptoms, but for some reason slipped by and got a COVID test that came back positive, if they never have symptoms, they do not have to quarantine for 14 days. The recommendation through the CDC is just 10 days after that positive test resulted. So they don't have to wait the entire 14 days, and there's not a true symptom-based strategy for them. So I won't go through all these, but I'd be happy to share these slides with anybody. But there are scenarios that I created to give to all the resident advisors and all the directors. And I think it's important for everybody to understand these, because just quickly going through, if a patient comes in that says, I was in the grocery store and I passed somebody who had COVID, I want to be tested. The answer is no, we're not going to test those patients because they don't meet the true contact definition by the CDC. If a student is in has had true contact with a patient and they become symptomatic, we're going to test them, just reiterating that. Just a couple of these I want to mention. If a Blinn faculty or staff member develops symptoms of COVID, we're going to ask them to report to their PCP and ask them to immediately quarantine. One caveat here is that there will be employees that do not have PCPs, and what we're recommending is that they set up an e-visit through Baylor Scott & White or another organization. Baylor Scott & White, I can tell you, has a fantastic system where they just text the word better to 88408, and that will automatically set them up with an e-visit, which will allow them to get drive-through testing at our 290 clinic. So the employees here will have direct access to testing. It just won't be through the clinic here on campus. That's all I have. Do you guys have any questions as far as any of the additional protocols or anything that we're doing on the campus? All right. Thank y'all very much for your time.
Dr. Alfred, I do have a question for you. How's your son's golf game doing?
My son's golf game is going well. He played in the championship round recently and did not do very well, but he overcame that and got a silver medal in a tournament on Sunday. So he's coming back. My son-in-law is Coach Odie. I've heard, yes. I was going to actually talk to you afterwards if I had time, but yeah, he enjoys Coach Odie.
He's a very polite and respectful young man, by the way.
Thank you. I appreciate that. Thank y'all.
All right, is that it? You got any more links? Does anybody have any questions about any of the presentation, any parts of the presentation?
I do.
Okay.
If I may, I just jotted down a couple of questions. For Dr. Busecki, which modality is of preference right now? I'm curious.
Thank you for the question, sir. It's fully online. We call it flexible online. That modality is, as of today, about 70% higher than the same time last year. I predict that by the end of the registration period, that we will get to 80 to 90% of the online classes over last year.
Okay, thank you.
Anything else?
I do.
All right.
It sounds like Mr. Anderson indicated that, he didn't indicate this, I read into it, that Blinn may be part of the COVID-19 solution?
That's right, with Fujifilms.
Okay.
That is correct. With Fujifilm, we're doing training.
Okay. And Dr. Lovell, where is our quarantine facility, if that is permissible for you to disclose?
I don't think it's top secret, although we
Oh, okay.
we don't want to violate anybody's HIPAA, but it is in Building 5 in the apartments.
Okay, thank you.
I have a question. Is Scott Shoemaker, are you on?
Yes, sir, I'm here.
Scott, I have a question. Just generally speaking, on all the athletic, the people that were that we had that were coming as to participate in the various sports, are they, even though we won't have activities the first semester, are those, for the most part, are those athletes still in line to be here and be prepared to go forward after when we can start?
You know, we've had a few of our athletes, we're not at 100% capacity, but we're very, very close to that. We did have some student athletes that decided to stay at home, but they are still taking classes online.
Thank you.
You bet. Thanks for asking.
Dr. Krausen has a question.
Sure.
Are we still, what's going to happen after Thanksgiving? Are you going to continue to have classes? Like A&M, I think, is stopping. University of Texas is stopping at Thanksgiving. What about your schedule?
Yes, sir.
Yes, sir. Classes will be essentially moved to an online modality after Thanksgiving.
All classes will be completely offline.
All classes will be moved to a remote capacity. So in other words, for classes that meet remotely on Mondays and Wednesdays at 8 a.m., that class will continue Mondays and Wednesdays at 8 a.m., but remotely. So the students will be able to access the class through their computers.
All right, thank you.
Along those lines, just out of curiosity, on the athletic side, if they've got 60 days to practice and they don't start until October the 1st, they're still going to be here on campus practicing until that 60 days is up?
No, sir. This is Scott. Thanks for asking. Once we decide once we decide when we're starting, when Thanksgiving comes and the classes, everybody leaves for Thanksgiving break, the athletes will leave for Thanksgiving break also. In other words, the 60 days is what they're allowing us. You don't have to practice 60 days, so you could practice 40 days if you wanted to. But as soon as Thanksgiving break comes and the classes go all online, then all of our student athletes will also leave the campus also. Does that answer your question?
Yeah, so the athletes won't get 60 days of practice.
Correct, correct.
Okay. I did have another question.
I'll just add a couple of things to those last two questions. All students will be online after Thanksgiving, and on the Brenham campus specifically, we won't be having them reside on campus any longer unless there's a handful that need to stay for out of the ordinary reasons. Otherwise, we won't have anybody residing in housing on this campus after Thanksgiving. There will be, however, a few students that may need to do through health sciences and workforce programs some sort of physical presence after Thanksgiving, so there could be a few, but not very many. And regarding to the athletic question of the 60 days, that's why we're trying to reassess at mid-September. So we've calculated the 60 days would start around September the 28th, and that's why we're trying to start for practices around that date to give them the full full 60 days. But depending on our status at that time, if we're having breakouts, we would have to certainly adjust.
Chair Moser, I had a question, Chair Moser. I think it's for Mr. Cervantes. The food truck, is that part of the student meal plan, or will there be an additional cost for the
Yes, sir. Thank you for the question. It is part of the student meal plan. They will actually have the swipes out there that they can swipe in.
Jim, Mr. Kokos, you had a question?
Yes, sir. On the protocols for our teachers to get back into their classrooms and to get their classroom prepared, what is the protocol for them to do that? Reason I ask, because I had gotten some concerns about scheduling a time to be able to go to your class and you only had 1 hour to actually be in your class to get it prepared. And I was just curious about that, if that was if that was a protocol that we were using.
I don't know that part. I'm sorry. That's first I've heard of that one. Marcelo and then Marie, if you all could please address Trustee Colcourt's question.
Yes, ma'am. Dr. Busicki? I can answer that partially as well, sir. What we asked this summer, as faculty wanted to come in, perhaps get things from their classroom or get things set up, we asked them to just let us know. We were working in coordination as well with the police department. So we knew who was on campus, when they were going to be on campus for safety reasons, because there were so few people there. The doors were kept locked, so in some cases the police had to let people in, that sort of thing. But we didn't ever limit anyone to an hour. We asked them to let us know what kind of time frame they needed, where they were going to be, what area they were going to be in. But that's the first I'm hearing that anybody was limited to like 1 hour.
Dr. Busicki, that's all I know too. Is there anything you could add? Is that what you know as well? You might refer that person to us and we'll be happy to try to clarify.
Any other questions? It's a strange time we're living in, that's all I know. It's tough for us old folks to try to get a hold of all this, but all right. We have no action on that. That's just reports. So I think that now takes us to our consent items. Trustees, you see that on item 7 we had 3 items under the consent agenda. I think that information has been provided to you, and you've had opportunities to look at it. If there's no questions, entertain a motion that they be approved.
So move that we accept the consent agenda in its entirety.
We had a motion from Mr. Wells, Reverend Wells. I have a second.
Second.
I have a second from Mr. Colcourt. All those in favor say aye.
Aye.
Any opposed say no. The motion carries. Thank you. That brings us down to number 8, the discussion and possible action items. Y'all, I'm going to have to take this off for just a bit here. We have, first of all, approve and adopt a resolution on the 2020 tax rate. Mr. Cervantes, you going to bring that to the board?
Thank you, Mr. Chairman, Dr. Hensley, members of the board. This is our annual event, the tax rate. We did run this. I did have a meeting with the Budget Audit Investment Finance Committee, and the administration and the committee agreed to move this forward to the full board for their consideration.
It's a tough night all the way.
It is a tough night. Mr. Chairman, this is not only bad for older people, it's bad for all of us, I think. Key terms have changed.
You know, back in my day, we'd just hand out a sheet of paper.
Sir, I'd go back to that now if I could. The key terms have changed, and so I wanted to run that by the board because we're used to using some of the other language. The effective rate is now the no new revenue rate, and the rollback rate is the voter approval rate. Just so, obviously, the effective rate used to be the rate where we didn't receive any additional revenue, so now they've further defined it. And the rollback rate is where we would, if we went below that, right below that, we were okay, but if we tried to go above it, then we had to get the full voters' approval. So they've just further give us a little clarification with the terms. So we did receive the information on July 29th. Mr. Willie Gilworth is here. He's ready to answer all the tough questions. The no new revenue rate had been set by the appraisal office at 0.0562 and the voter approval rate at 0.0570. The current rate that we have right now is 0.0560, which is below both of those. We have some options available to us. What we're recommending, I'll just cut to the chase, is the current rate, which would mean, Mr. Chairman, if the board agrees, that we would be able to vote on this tonight, and we would not have to hold any additional hearings or vote on any of the other items at a later date.
Thank you.
The tax rate history on the far right, you can see what we've approved all the way down from 2005. You see the 2019, that's our current rate, and 2020, the two rates that I've just described. So our tax rate history for Washington County on the far right, you see all the way down to the bottom, 0.0560 is where we are right now. But this also shows all the rates for all the other entities that receive revenue from Washington County. You can see the one right above us, the Oak Hill FWD, the Water District, is about 6.5 times higher than Blinn's rate. So we're the lowest of the low in terms of rates for the Washington County Appraisal Office. Statewide 2019, this was just recently updated. You can see the bar in the middle, which is the average for the 50 community colleges. It's somewhere around 0.18, which is about 3.5 times higher than what Blinn. You see our chart on the far right, our bar on the far right. We are the lowest of all the community colleges and continue to remain so. The revenue source as a comparison, this is showing the three main sources of revenue that the college receives and all the other 50 community colleges receive: tuition and fees, state appropriations, and taxes. The green represents the tuition and fees. Blinn is on the far left. You can see ours is one of the highest in terms, or the highest in terms of tuition and fees revenue as a comparison of these three items. And then you have to look closely. The red dot there represents the tax revenue that the college receives as a percentage of that total. This, we refer to this frequently, Mr. Chairman, as a three-legged stool. This is the three primary sources of revenue: the local property taxes, state appropriations, and student tuition. This highlights the amount as a percentage of the total that is coming from student tuition and fees. It doesn't show all of it. It doesn't show auxiliaries. That is an example that also comes from students. This slide shows on the very bottom, the green slide, which represents the property tax. All the way back from 2009, we were receiving 1.8% of the total of all these, and now it's at 1.4. It's continued to drop as a percentage, probably less of a reflection of the fact that revenue has dropped and more of a reflection of the net tuition and fees has just continued to go up, and that's one of the larger ones. We are trying to look at this every year, the maintenance and operating costs for the Brenham campus alone, because ostensibly this is what the taxes, the revenue that we received are here to pay for. We're receiving a little bit over $2 million a year. This is budget fiscal year 2021. As you know, we decreased this considerably because we weren't expecting as many students. We dropped it close to 20%. Last year, this was $6 million. So we've dropped it quite a bit. The $2 million will cover close to about 2/3 of it. Normally, it's a little bit less than half. These are the three rates and what they will generate in terms of revenue. The one on the far left is option one. The current tax rate of 0.056 will generate $2.2 million. Also, option two will generate $2.2 million. So not that much difference in terms of the actual tax on a $100,000 home when it goes from $56 to $56.20 between those two options. Option three, the voter approval tax rate on the far right, would be $61.10 on a $100,000 home. It would, if we were to choose that, generate $166,221. But Mr. Chairman, members of the board, the administration and the committee were focused on option one, and this is what we're recommending today, that we retain the current rate that we have right now, a 0.0560. We will generate a little less revenue, but not that much to speak of. And that concludes my presentation, Mr. Chairman. If we could have a motion, if the board so chooses.
You've heard the discussion.
I move that the board approve the suggested tax rate that we've just heard, and
Okay. We had a motion from Mrs. Bain that we adopt the current tax rate of .0560. Do I have a second?
Second.
We have a second from Mr. Colcourse. Any discussion on the motion? All those in favor say aye.
Aye.
Any opposed say no. Motion carries. Thank
Mr.
you, sir.
Chairman, I'd at least like to thank Willie for being here. He said he had a good meal this evening, and you didn't even have to answer anything.
Good to see you.
Thank you, Willie. All right, let's move along. We've got still some very good things to be doing here tonight, so we need to move along. And so, Richard, if you'll take us into Mr. Cervantes, if you'll take us into number 2 to B, then we'll move on to the issuance and sale of revenue bonds for 2020.
Thank you, Mr. Chairman. I'm going to introduce Mr. Stephen Adams in just a second, but before I do, I'd like to give a little frame of what we're attempting to achieve here. We do want to issue bonds in somewhere around $31.1 million. That is our objective, but the other further objective of that is to do a couple things. One is to refinance our 2010 bonds. We have some bonds out there that are going to be callable in October, and as Mr. Adams will convey to you, they were initially issued at an interest rate that was substantially higher than what we're going to be able, hopefully from what we're going to be able to do when we sell these. But then the second objective is to pay for a portion of the Relis Phase 2 building that we hope to construct. We will use $18 million of that, of the bond to pay for that $32.2 million building is the budget that we have. $14.2 million of that will come from our reserves. And so, Mr. Adams, if you would come up and provide a little bit more detail, I'd appreciate it.
Thank you, Richard. Chairman, Ms. Chancellor, members of the board, Stephen Adams, Specialized Public Finance. This agenda item we also went over in the committee that went over the tax rate. It has a very long name that I can never remember. But anyway, as Richard pointed out, what we're seeking to do here is to sell one bond issue, and it's going to have two purposes. So from the perspective of Blinn College District, we'll be able to break those two purposes out to the penny for budgetary reasons, but the firms bidding on these bonds, they're just going to see one bond issue. So it'll be one bond issue from that perspective. The bonds will not exceed $31 million. Now, I will go over that in a little bit. The refunding portion that Richard referred to, that is refunding the Series 2010 bonds, will not exceed $12,890,000, will be approximately that size. The Series 10 bonds have coupon rates between 4% and 4.375%, depending on the maturities. We estimate that when we ran the numbers that you'll see tonight, a 1.72%, we'll know that when we bid the bonds. We had 25 basis points of cushion in there on that, so we're talking really about 1.5%. Of course, there could be some movement in the market between now and the time we bid the bonds. The refunding will save approximately $1.76 million in interest, or on a present value basis, that amount is 13% of the bonds we're refunding, the principal amount. So it's like taking 13% of the debt off your books. In terms of the the Relis campus, we are looking at issuing an amount of bonds that will generate $18 million for that campus, and we're going to use approximately or about $14,250,000 in cash. So those two sources will fund that next expansion of the Rellis campus. That new money portion will have a 25-year term. The refunding portion will have a much shorter term, about 12 years, that will match the maturities of the bonds being refunded. So on that section, the refunding will just take the debt service straight down. It is not going to extend nor contract that part of the debt. So your debt service will have one portion that's higher, and then it will go down for 25 years for the remaining portion. On that new money part, we ran these numbers at 2.26%, which again has 25 basis points of cushion. So as you can see, these rates are much lower than any debt that we've ever sold for any bonds here at Blinn College. So the refunding summary on the far right is the savings. So we estimate we'll save approximately $175,000 between the years 2022 and 2032. So we're not extending that piece of the debt or shortening it. We're just saving every single year. It's like refinancing your house, just bringing the debt service straight down. And again, the Series 2010 bonds have a total amount of $12,940,000 outstanding. We'll have to add some cost of issuance to that, so a little bit more of that will be the new issue. So again, any questions on the refunding part? If not, I will move on to the new money part. Okay, the new money bonds, the section in the middle, a lot of small numbers, we apologize, but there's one thing that we would like to point out here. It is 25-year debt, but you can see the principal in column C, and you see that the principal is higher in the first couple of years, $950,000, and then a little over $1 million in 2022. The reason for that is, if you look on the total debt service column, the total debt service that is due in 2021 for Blinn College is $8,778,000. So working with Richard and his staff, they determined that they felt comfortable with that amount of payment. Your existing debt drops off. So if we did this level, that debt would drop off as well. And so they wanted us to add those principal payments for those 2 years. They feel comfortable paying more of that debt service for the next 3 years within the budgets that they're expecting over the next 3 years. And then at that point, your debt service will fall off, leaving room for any potential new debt that you may have if there's another expansion to Rellis campus or anything else that you might have in the next 3 years that you would like to issue bonds for. You also note, so then, that the debt falls off in 2024 to about $7.5 million annually, and then that goes on until about 2033 when it starts falling off even another $1.5 million or so beyond that. So you do have a lot of debt capacity over the years here at Blinn College, so that you should be able to sell debt and keep your debt service level and continue to expand the campus. So as I mentioned, there's going to be one bond issue, and that's the total on the far right. Internally, we'll break it down to these two components. So the total amount will be $31 million. Approximately $18,110,000 will be for new money, and approximately $12.89 million for refunding. We don't know the exact size until the bids come in, because they could bid a premium, which they would pay us more money than we asked for, in which case we would lower the principal amount of the bonds, or they could bid a discount, depending on how they wanted to coupon it. And Blinn College is going to add cash not only for the amount of the $14.25 million, But also for the reserve fund, they're going to add another, Blinn is going to add another $133,000 from cash on hand to this transaction as well. And then finally, that $167,000, you're required to make monthly payments into your INS account. That money is sitting there for those 2010 bonds. It's already there. It's for the next payment in October. We're going to sell before that and just put this in the debt service fund. And that's a requirement of federal tax law. So that's where that other source of money comes from. So I know that's a lot of numbers. If you have any questions, let me know. I'll try to clarify those. Okay, otherwise I will move on. So one thing we're asking the board to do tonight is something a little bit different for Blinn, but it's very common around the state. So within the statutes, you have the right as a board to approve this bond issue tonight, but to delegate the final terms to a pricing officer, in which case this document's named that as either the chancellor or the CFO. It uses their correct titles. But other than that, those two positions could sign this. So what we typically do is take bids the day of the board meeting and bring them to the board. Because your September board meeting comes a little bit early, just the way the calendar falls, and because we're having trouble getting timing on when we can get a bond rating, we don't know that we'll be ready to sell at your September meeting per se. The problem with the ratings, interest rates are very, very low. You combine that with they're all working at home and they have to put this in committees. They have been unable to give us specific timing as to when they can get a rating back to us. And so this gives us flexibility that we can sell these bonds if within these parameters that are delegated by the board. And those parameters are specifically the refunding portion may not exceed $13,500,000. The new money portion may not exceed $19 million, specifically those two portions. The final maturity may not exceed 10/1/2045, which is the 25 years that the new money will be. The present value savings of the refunding, which we currently estimate at 13%, must be at least 3%. The savings of the refunding must be taken annually, equally, approximately equally, so we can't extend the debt, we can't shorten the debt. We're going to do exactly what we're showing you here. And the overall interest rate may not exceed 5%. And each of these parameters are spelled out and must, by statute, that have to be dictated for you to delegate this final authority to sell debt to the pricing officer. Now, once we're going to do this sale competitive bid, hopefully around probably a week after your next board meeting in September. And so we'll take the bids. If we meet these parameters, the pricing officer may sign the bid form, and then we'll come back at the next meeting and report the results to the board. Just a little bit of information, because we are calling the bonds, which are the ones represented in pink. Your next round of callable debt will be in 2024, 25, and then the big ones are 2016 and 2018, because 10 years prior to that, you started doing the large bond issues for your campus improvements. Finally, this is interest rates. I looked at a graph of this today that we just updated. That graph on the far right, where the interest rates come down, just comes down even lower. And the zigzag you see there is when COVID started. It's really a guess because the bond market was completely locked up at that time for 2 or 3 weeks. But it's a good time to be selling bonds. We think you're going to get good rates if everything holds true. And we think that it'll be very beneficial for the district. Finally, if everything goes right, if we can get to selling on September the 15th and bring it to the board, we will. If we can't get a rating in time, we'll have to sell it a week or so after that, and we'll close around mid-October. And that is all that I have, and I'd be willing to answer any questions. Hopefully Richard is here as well. Chairman?
Any questions? Douglas, you want to give us your summary of the meeting, the budget?
Well, yes, sir. I think at our meeting, there were a number of alternative options that were discussed. One was whether or not it might not be better to increase the amount. Basically, from a position that typically you finance long-term assets with long-term debt, and we're putting quite a bit of cash into the situation. But at this juncture of the game, there's no way we can go back and redo that from a timing perspective. I guess we'll just have to proceed as recommended. However, I think in the future, we probably need to look at that a little more closely in a more upfront cost to really analyze that from that perspective. But I don't see any way we can change any of that right now, unfortunately.
Mr. Kokors, you're on the committee. You okay with where we are?
I am. I think that we came to that determination after a lot of discussion that these new parameters put us in the best position possible to get what we were looking for. So, yeah, I'm comfortable with that.
All right, Steve, I don't believe we have any other questions then. Do we have, Mr. Savani, do you have anything else to add to the discussion?
No, sir, we just need a motion.
Is there a resolution that outlines I know I saw something a while ago, but I'm not on the right page right now. Would somebody want to make a motion?
Yeah, I move that the administration would give the authority to the administration to proceed with the issuance sale, Revenue Bond Series 2020, and the refund of Revenue Bond Series 2010.
Okay.
Second.
We have a motion from Mr. Kokors. We have a second from Randy. Mr. Wells, any discussion on the motion now? Dennis, you okay? Teddy, any questions? Talk about it. So we're all right. All those in favor say aye.
Aye.
Aye. Any opposed? Motion carries unanimous. Thank you. Okay. That brings us to item C, which is my. Okay. Right now. Okay. It's been requested that we take a break for just a few minutes, and then we're going to finish this part, and then we've got an executive session. Let's take a 5-minute break, and we'll be starting back then.
I'm glad you did. I was thinking about it myself.
Apparently so.
It happens.
It is gone.
I'm real happy to do it.
Did not vote against that. Set him up with transfer.
You know, I think we have done that.
Next one is going to be the repurpose, I guess.
No, I'm just going to mute us.
Oh.
That's all.
not going to be skinny like me. Which is good as a pitcher. You know, those pitchers are pretty good.
You know, I saw a picture of your dad when he was playing football.
Oh, yeah?
I'm sure you've seen it. Find it. I don't know if you remember Calvin Yonner.
Yeah.
He put together the brochure of all the from 1950 to 1960. I think he was in that. He was. He was just motivated to do that. So he had a picture. There was in there. Whatever year it was. He was a pretty. There was a very strong resemblance to him. He was a lot lighter than that.
Yeah, he was. I mean, he was pretty tall and skinny. He was about 6'4".
It was just a Xerox. He had Xeroxed it all, but
We hadn't had one of those in a while.
It's pretty good. A lot of guys like that.
They're talking about being cold. They're talking about being cold over there.
Oh.
Here, I don't know.
Head coach. He must have been pretty tough.
Tommy Mims he finished up and they got really bad. And then until
yeah. I got some of those old Washington.
Yeah. Let's go, folks.
Yeah.
We're going to take up item C, which is one of my favorite subjects. We're going to authorization for the administration to repurpose a portion of the remaining 2016 bond proceeds.
We put that in the same category as the cast stone repair and replacement on the Bryan campus, right?
That bond issue has far exceeded itself in what all it has accomplished. So.
Thank you, Mr. Chairman, Dr. Hensley, members of the board. You know, I really do think we're going to look back at this 2016 bond series, and although it's lingered, it's done a lot of things for us, a lot of really good things. So it's worked out definitely to the college's advantage. We do have $1 million left. We are required to spend all of this. It was issued in 2016. We are required to spend it all within 5 years. February 1st, I think, would be the 5 years, February 2021. So we're getting close enough, getting nervous enough that let's make sure that we're going to be able to do it. The big hanging project out there was the Brenham signage monument, the 481. So we're going to put that one by the side for now and try to move more money, as well as some of these other projects have closed out. And so here's what it's going to look like after we're done. The bulk of it is going to go down. The $800,000 is going to go to our science technology. So 2016 money, a portion of that, we had some of it in there already. We're going to have a little bit more. We had intended close to around $3 million, Mr. Chairman, that was going to be spent out of our reserves for science, for the science building. Now we'll only have to spend $2.2 million of the reserves as we move this down. This should complete us without too much of a problem. I think by Halloween, Mr. Chairman, we should have all of this done. So by the end of October, I'm thinking we should have everything spent. So that concludes my presentation. Be happy to respond to any questions.
Mr. Chairman, I just want you to know that 2016 bond issue was planned to have been spent in 18 months, but it was on the Leonard Road project. And probably too many people sitting around this table are even unaware of that. But and so what happened, we ended up with the Relis opportunity. So we had to figure out some other way to do it. And under your leadership, it took us 4 years to do it.
Well, it has touched a lot of property. All right, well, let's take it. Do I hear a motion that we approve the recommendation from the administration on the authorization to repurpose a portion of the remaining 2016 bonds?
So moved.
We have a motion from Mr. Bohart. I have a second. We have a second from Dr. Krausen. Any discussion on the motion? All those in favor say aye.
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 Any opposed say no. Motion carries. Thank you very much. Okay, it brings us to item D, authorization for the administration to negotiate and execute a contract for construction manager at risk on the Rellis phase 2 building of the Blinn Rellis campus. Mr. Cervantes.
Thank you, Mr. Chairman, Dr. Hensley, members of the board. I'm going to pass this over to Mr. Feldhake, who's online, and he will make this presentation.
Thank you, Mr. Cervantes. Chairman Mosier, Dr. Hensley, members of the board. Can you all hear me okay?
Yes.
Thank you. I'm here tonight to present agenda item 6D, which is a request for authorization for administration to negotiate and execute a contract for construction manager at risk services for our Rellis Phase 2 building. And this authorization would allow us to negotiate and execute a contract with Bartlett Koch General Contractors. A little history with Bartlett Koch. They were actually the contractor that we worked with when we teamed with the Texas A&M University system on the new Ag and Workforce building. On July 23rd, the College District received proposals in response to our request for qualifications for construction managers. And we put together a diversified 5-person search committee to review those proposals. That search committee then invited 3 of the highest ranked firms back for interviews on August 4th. And based on the qualification proposals as well as the interview, the cumulative scores were identified, and and from that, administration recommends that the board authorize administration to negotiate and execute a contract with Bartlett Koch General Contractors. The overall project budget for this is $32.25 million, of which we have allocated $25.6 million for construction costs. And funds for that project are available, will be available from a 2020 bond issuance as well as Blinn's reserve funds. And with that, I'll stand for any questions.
Any questions?
Yeah, was there any, I mean, you might have already mentioned it, but what was their overall greatest qualification that you felt like they should do this project?
They've had some very good experience working on the Rellis campus, which is a unique environment considering the teaming aspect. We had really good, a good aspect of their leadership team, from their senior project manager on down through the various other site superintendents, project managers. That was a very good aspect. They really came prepared in a lot of their presentations and in a lot of the information. They were very, very thorough in the information that they presented to the search committee. And they also provided us with some reasonable costs and some of the proposal information that they put together.
Thank you.
Any other questions? Do I hear a motion that the board authorize to the administration to negotiate and execute a contract for CMAR services related to the Rellis Phase 2 building on the Blinn Rellis campus with Bartlett Koch General Contractors? Do I have a motion?
So moved.
We have a motion from Reverend Wells. Do I have a second?
Second.
Who was that?
Either one.
Dr. Krausen, second. All those any discussion on the motion? All those in favor say aye.
Aye.
Any opposed say no. Motion carries. Thank you.
Thank you.
Thank you a lot. All right, that gets us to our last item in the public session of our meeting. If you would, trustees, if you heard Dr. Hensley acknowledge in her opening remarks about Trustee Gatewood, who has left the board last month and is changing his location. He's moved from, as I understand, he's moving up to Oklahoma very shortly, very quickly, and he's got his house sold here. I think is obviously deeply involved in the oil and gas industry, and so I think it's dictated that he has to kind of move with the business, and so he did a fine job with his. Regrettably, he wasn't with us long enough to be able to be deeply involved, but he did a great job when he was here. He was very attentive at the meetings and very much involved with the reading of the material. We do have a resolution here. We have it printed out and we have it ready to present to him.
Rich and Lori, if you would please stand and show it to the trustees.
Plaque. Mm-hmm. He's not here. I think his wife is taken ill the last day or two or something, and so he's unable to be here. He planned to be here, but we will present those. Laurie will see that those are gotten to the Gatewoods before they leave town. And if I would like to, if the trustees, anyone have anything to say, or if not, we do need to adopt a resolution honoring Mr. Gatewood for his service to the board. I'd entertain that motion.
So moved.
We had a motion from Dr. Krausen. Do we have a second? From Mr. Bohart? Any discussion? All those in favor say aye. Aye. And Laurie, if you would do that and extend our appreciation to him again for his work. I will do that. All right, thank you. Trustees, we need to go into executive session under 551.071, 072, and 074. We took a little break, but I think we'll take another break. That'll allow us to clear the room, people that will be leaving, and then we'll reconvene. It's 7:47. How about 10 minutes? At 7:57, we'll reconvene in here, if that's all right.
All right.
Yeah, I mean, I just referred her to Dean Turner. I said, look, call him, talk to them, and figure it out. And I think they got it resolved.